Good day po, ma'am, sir. I'm Amira Alexa Almatias, a level 2 nursing student from Holy Angel University, and today I will be demonstrating to you how a student nurse will be assisting with normal childbirth. Now, I would just like to remind everyone that this procedure is just utilized using the models that we have at home due to our current circumstance. However, this is just serving as a practice demonstration for us student nurses to be familiar with the process or the procedure that we would soon be reenacting, both in the model in the nursing arts laboratory and in our duty. Thank you. So, good day po, ma'am, sir. Now, due to the angle that we are filming, I cannot be seen throughout the process that I would be doing my practice video demonstration for normal childbirth. But rest assured, I'm the one who is doing all of the procedures. So, without further ado, let us already begin with the procedure. So, I have already set up the delivery bed together with the kelly pad and appropriate linings and the pillow for the comfort of the mother. And I've also performed hand hygiene and donning of my gloves prior to entering the room. And I've also prepared the materials that we will be needing throughout the childbirth procedure. So right now we're going to be assisting the mother. After all, childbirth is really difficult, so we're going to be assisting her slowly. And then we're going to be guiding her buttocks here along the kelly pad and allowing her to lie in the lithotomy position, because that is actually the ideal position for childbirth, for normal childbirth. So now we're going to be getting some cotton balls that are just saturated with normal saline solution, and we're just going to be performing gentle perineal care. And then we dispose quickly. And then now for patient privacy, we're going to be draping our patient, starting off with aseptic technique, of course. Okay, now for the other leg. Now we're going to be draping our patient's upper body, only exposing the part that we will be needing. And then we're also going to provide for emotional support for our mother, and we're going to let her know that everything's gonna be alright, ma'am. It's going to be okay. This pain is just temporary. When you see your baby for the first time, it will be amazing. It will be memorable for you. It's going to be okay. You're gonna be a great mother. And then we proceed to the second stage of labor. We performed my second step of hand hygiene together with the donning of my surgical gloves. So now we're going to be asking our mother to pant and take deep breaths while she's giving pushes. So, ma'am, hinga lang po tayo ng malalim, ha. Hinga lang po tayo ng malalim. Tapos magpupush po tayo in 1 and on the count of 3, okay? So 1, 2, 3, push. Okay, mami, okay. Hinga po tayo din na malalim. Deep breaths lang po. Okay lang po, okay lang. Tapos, push po tayo ulit on the count of 3, ha? Okay, 1, 2, 3, push. Okay. And then when we see the head of the baby already crowning po, we're going to be guiding it with one hand. We're going to be maneuvering it po para makontrol po natin, and at the same time, allow yung natural stretching po ng perineal tissue, and at the same time, ma-maintain yung flexion. And when the baby's head is delivered, i-wipe lang po natin yung excess mucus through a bulb syringe. And then, we're going to allow, and then any form of cord po na detect po natin around the baby's neck, we're going to be acting appropriately and gently removing it from the baby's neck. And then we're going to allow the baby's head to turn on its own. Begin to deliver the anterior shoulder. And then when the anterior shoulder is already here, we're going to guide upwards as a posterior shoulder. And then we're going to be supporting the rest of the baby's body with one hand as it slides out. And then we're going to be getting rid of this drape temporarily. And then we're going to be placing the baby here on the mommy's abdomen. Of course, skin-to-skin contact for 60 to 90 seconds is important. And then we drape over and thoroughly dry our baby to provide warmth and comfort. So now, as we give the 2 to 3 minute time limit, 2 to 3 minutes of skin-to-skin contact with the mother and the baby. So that is after that 2 to 3 minute time gap, that is the time that we are going to be clamping our umbilical cord already, or when pulsation stops. Now we gather our clamps, and it's approximately 5 centimeters from the base, and then 2 centimeters here, away, and then we cut it here in the middle. So as we cut it already, we ensure that the skin-to-skin contact between the mother and the baby is correct, and at the same time, we also assess for the baby's breathing. So now, as administered, we're going to be delivering 10 IU oxytocin intramuscularly as ordered. Palpate the mother's abdomen. So we palpate the mother's abdomen to rule out the presence of additional babies and proceed with active management of our third stage, aka the placental delivery. Now we're going to be assisting our baby, and then the other nurse, the nurse specified for the nursery room, will be the one that would be taking care of the baby for newborn care. So now we're going to be draping our mother properly and preparing as well for the placental delivery. So now we're going to be inspecting for any signs of placental separation, like an altered appearance of the fundus or excessive bleeding. But as of now, we can't see any signs of placental separation, and then we're also going to be observing for cord recoil so that we are going to be able to manage it correctly. And then, once we do that, once the uterus is already well contracted, we're going to be we're going to be holding down the cord gently, pulling it downwards. And then, when we see that the placenta is already delivered, we're going to hold it with both hands and gently twist it so that we could get it out fully. And then we examine the placenta, the membrane, and the cord. So the placenta, it has to be intact because any remaining pieces of placenta within the mother's uterus would cause excessive bleeding. So we have to make sure that it is normal in appearance, in color, and in weight. Remember that the placenta weighs approximately 1/6 of the baby's weight. So now we're going to be setting it aside in a particular basin. And then we're going to be massaging the uterus if it is well contracted, and examining the vagina for any lacerations or excessive bleeding. So after that, we're going to be cleansing the perineum. Then we're going to be disposing it quickly. And then we lay an adult diaper or just a pad. We're going to be laying it here. And then we're going to be assessing the amount of blood loss if it is normal. And then afterwards, we're going to be checking the VS of our patient, and then we're going to be employing the interventions so that we can achieve and maintain a well-contracted uterus to prevent any bleeding. So what I will be doing is I will be providing a uterine massage, and I will be applying an ice pack, and then we proceed to the post-procedure tasks. Now that we are already here, so we're going to be getting rid of the helipad. Okay? And then we're going to be guiding it along a basin for it to be disposed. We removed our used gloves by turning them inside out and disposing them. And then we will be performing hand hygiene. In my case, I'm just going to be sanitizing my hands. Hand sanitizer. And then I'm going to be assisting my client as we go from the delivery room to the recovery room. And I'm going to be monitoring her vital signs until they are stable. And of course, we're going to be monitoring the pads from time to time for any form of postpartum bleeding. And then, afterwards, I'm going to be documenting the relevant data here in my nursing notes together with my other monitoring notes. And that concludes my assisting for normal childbirth. Thank you, ma'am, sir. Have a good day.